This is a Jet 24, Fox 66, YourErie.com special report.
Good afternoon. Once again, we interrupt our programming to bring you a special report, an update on the spread of COVID-19 in Erie County and the Erie region. We want to go now live to the studios of WQLN Television. Here's Erie County Executive Kathy Delkemper.
Good afternoon, and thank you for joining me this afternoon as we talk about the COVID-19 pandemic here in Erie County. Unfortunately, today, I have to announce that we have 7 new positive cases of COVID-19 in Erie County. That brings us to a total of 53 positives. We've had 1,213 negative tests. Of these 7 new cases, 1 is in their 20s, 1 is in their 40s, 2 are in their 50s, 2 are in their 60s, and 1 is in their 70s. 3 of these new cases are connected to a known positive. 1 is related to travel to an area where we know COVID-19 is very prevalent, and 3 of those are still under investigation by the Department of Health. 4 of the new cases are located in Zone 1, 2 in Zone 2, 1 in Zone 5. And this can be found on the cumulative cases map by zone at eriecountypa.gov. Contact tracing, as always, continues by Erie County Department of Health. On the state, the numbers now are over 29,000, 29,441, and the deaths are 756. This is 1,706 new cases and 49 new deaths recorded in the past 24 hours within the Commonwealth. Warren County still has 1 case, Crawford County 16. Chautauqua County has 27 cases and 3 deaths, and Ashtabula County has 45 cases and 3 deaths. We all need to continue physically distancing, as you can see. We need to continue good hand washing, 20 seconds, sanitizing all of our surfaces, and wearing our masks. You can find information about masks under resources on the COVID-19 page of eriecountypa.gov. The new order issued by Secretary Levine, set into effect this past Wednesday, has understandably sparked a lot of questions. The enforcement team at the Health Department is actively seeking clarification from the state and working on guidance to help you, our life-sustaining businesses and organizations, be in compliance, and to help you, our citizens who visit those businesses, to also be in compliance. Yesterday, I asked all of our businesses to start to develop a written policy on how they would comply with this new order. Once you've developed your plan, please keep it on site. You do not need to send it to the Health Department. But if you are in need of any help in writing your plan or have information about how you can better comply, please email your questions to ecdhinfo@eriecountypa.gov with any questions. And you can also always call 451-6700. These measures are not punitive in how they are being implemented. We're here to help you and to help you comply. And we're going to continue to help you. This is truly the first step towards recovering and restarting the economy in Erie County. So we're masking up for recovery. If we begin these measures now, as we start heading to a recovery, they will become standard practice when all of our businesses are able to reopen. But if we don't do this, we will undo the work that has been done so far. I want to tell you that I have reached out to the governor's office, and I have offered for Erie County to be looked at as one of the first places that could be reopened for business because of the citizens and how well you all are coming together, and our businesses and how well you've come together to support all of these measures that we've been putting in place. But to be considered by the state We must demonstrate that Erie County is using masks, that Erie County is taking temperatures of all their employees coming in the door, and that Erie County is taking precautions necessary to prove to them, the state, that we are a perfect place to pilot the reopening of our economy. Now, the type of thermometers that are needed, and this is in the order, should be medical use or non-contact thermometers. The thermometers that restaurants have to check the temperatures of foods are not adequate. They are not calibrated to the level they need to be. In Erie County government, we thermometers. The thermometers that restaurants have to check the temperatures of foods are not adequate. They are not calibrated to the level they need to be. In Erie County government, we had actually already begun to decide to do this, and our thermometers arrived today. So we will now be doing a temperature check on every employee coming into our building. I fully believe that the citizens of Erie County can truly set the example for the state and beyond. And I truly believe that we can prove that we can get back to normal, get back to work by following the proper guidelines. I spoke with EMTA CEO Jeremy Peterson, and he and EMTA strongly recommend that all passengers wear masks while on board EMTA buses. The key points for passengers are posted on all EMTA assets, including keeping that 6-foot social distance. Please enter and exit the buses by the rear door if you are able to minimize contact with that driver. If any media outlets have additional questions or concerns, please direct them to J. Peterson at ride-the-e.com, or you can call 814-452-2801, extension 115. Once again, there is a lot of information and resources at eriecountypa.gov, including how to make your own mask. You don't need to have something fancy. Again, just something that covers your mouth and your nose. So go to our webpage, or you can always call us at 451-6700 and email us at ecdhinfo@eriecountypa.gov. Yesterday, I was asked some questions about what the county is doing and how we are looking at our fiscal picture specifically. So I will let you know that starting Monday, as I said, we will be taking temperatures of our employees and requiring everyone to wear a mask. Unfortunately, we will also be furloughing our non-essential employees beginning on May 1st, and they are being notified of that today. The following directives will be effective immediately for county government. All job openings must remain open for a minimum of 60 days unless deemed absolutely essential to the business operations by the Director of Human Resources. We're eliminating all unnecessary travel for the remainder of 2020. All travel outside of normal business operations must be evaluated and approved by the Director of Finance. And we're eliminating all non-essential and emergency purchases and non-emergency purchases. And the Director of Procurement will be, as always, reviewing and evaluating all purchases very closely. And department leaders will be requested to limit all overtime for the remainder of the year as much as possible. Hopefully, our furlough will not last long. Hopefully, we can get them back to work and all of you back to work and be back to business as usual in Erie County. But again, that is only going to happen is if all of us, all of our businesses that are open, all of our citizens, all of us come together to follow the directives that the state has put forward. And now, President Judge Trisilla will share an update on measures being taken at the Erie County Courthouse when it comes to the courts. Judge Trisilla?
Thank you, County Executive Dahlkemper. I'd like to take this opportunity first, before I address the public, to thank you for your leadership. The daily briefings are both helpful and insightful. I think they give our public confidence with information. And I also want to personally thank you for being so cooperative with the courts as the judicial representative of this part of government, I wanted to let the public know that your staff and your administration has been always willing to cooperate with our department and our administration, and it's been very helpful in framing our policies. So thank you very much. Good afternoon, ladies and gentlemen of Erie County. Thank you for this opportunity to update you on the status of court proceedings on behalf of the Erie County Court of Common Pleas. Yesterday, I issued the third judicial emergency order. I found that in discussion with our administrative judges as well as our court administration, it was vitally necessary to extend the emergency order through May 31st. So then we would commence, hopefully, June 1st, our normal, regular operations. Noting, of course, there may be a new normal now to things. But again, it extended that time. So what that means is that our May trial term is now being suspended. So if you are a juror who got a notice from me to serve in that capacity, that obviously now is mooted. You do not have to appear, and it would be as if you did serve. So I thank you for that. I also wanted to note it was important to let the parties and litigants know because, for example, I had a scheduled murder trial for May 4th. It was important to let the parties know that that now is suspended. I was aware of a medical malpractice case where, for example, there were 10 doctors from across the country that were listed as experts that had to be notified. So it's those kind of logistics that have to be addressed, and that's what the emergency order does. It lets the parties and litigants know that we are extending our emergency. We've now had a better picture to see what our emergency status looks like. As outlined before, we are closed generally for business, but we still remain open for those critical or emergency types of hearings. So now, to give you more information on what that looks like, we, for example, in the family division, we have a rotating basis of judges that handle on a daily basis motion court at 9 a.m., and that usually addresses the emergency custody petitions or issues or motions. It also addresses emergency guardianship requests filed, for example, on behalf of an incapacitated person or on behalf of a minor that contemplates their safety and well-being. And in the case of an incapacitated person, it's necessary to protect, obviously, their financial interests. So those matters are heard on a daily basis. Then following that motion court, we would go to temporary protection from abuse orders to address individuals who want or seek the permission and order of court to be protected from someone who is alleged to have abused them. Those are very important, and we consider those critical hearings, and we have those on a daily basis. Then we have final protection from abuse hearings. Then we also have included the indirect criminal contempt hearings for those matters that are contended or alleged to have been violations of those protective orders. Those are the types of hearings that we're having. Also, I can report personally and in my discussion on a daily basis with the family judges that we still are continuing with our dependency cases. And so I want to commend the Office of Children and Youth, Lana Reese, Solicitor Amy Jones, and their staff for facilitating how those hearings are manifesting themselves. It's vitally important that a child who's declared dependent have the right to have a hearing to determine whether they should be reunified with their mother or father or both. And I have considered that a critical matter, so we are still conducting those hearings, and I want to thank those family judges who have accommodated their schedules and their courtrooms for safe practice, to include video conferencing, polycommunication, and of course safe distancing and just safe practice overall. We're also attending to the delinquency matters. That would be any juvenile, so in other words under age 18, who is in detention. I am personally handling those matters because I think it's important that when you have a detention of a juvenile, that matter be heard expeditiously. So those are being heard. In the trial division, again, we have a duty rotation of judges that are hearing actively pleas guilty pleas, sentencings, revocations of incarcerated defendants. Again, because they have a protection under our Constitution to have their matter heard in a timely and speedy fashion, those matters were considered critical, and we've been doing that now for a month. The original emergency order took place on March 16th, and actually took effect March 17th, so almost to the day I've extended the order to June 1st. As far as what the empirical numbers go, our employees through the court system are about 350. 260 actually physically report to the county courthouse. Because of the emergency order, we now have 80 physically reporting, so that has also reduced the risk of safety to those employees as well as the public. And on an average, we have between 1,300 and 1,500 members of our public visiting the courthouse for various matters. We've reduced that to less than 20. So again, I think the courts are participating as a piece of this puzzle to ensure the safety of not only the community but our employees. I also wanted to thank Sheriff John Loomis and his staff. They are part of the unsung heroes that are still reporting on a daily basis to ensure the safety of the court and the courthouse, and they're there actively screening individuals who do come to the court. There are many unsung heroes, and I don't have the time, and I would be remiss going through the list of thanking all those individuals. But trust that the courts are working on a daily basis to balance those needs of the public as well as the needs of the court employees, keeping both safe and getting to our critical hearings. We have supported County Executive Dahlkemper's mask initiative. I think it's safe practice. I am leaving, however, the discretion to utilize a mask up to each individual judge. Once you appear at the court room of that assigned judge, then it will be up to that judge to determine in their discretion how to manifest that practice. I will guarantee that there will be no one denied a hearing because of a lack of mask in traveling from the entrance where you're screened to your courtroom. Those will be made available, and that would never be an impediment to having your right or matter heard in a courtroom. I want to thank you for your patience. Again, we're acting together in this. It's truly been a team effort, and there isn't a day that doesn't go by that we don't collectively meet and discuss how our policies can be improved or in any way enhanced. So thank you for your patience, and thank you, County Executive Dahlkemper.
Thank you so much, Judge Trisilla, and it's been a great partnership with the judge and the court system, as well as with all the elected officials across county government. So I really give a huge thanks to each and every one of them. In closing, I would like to invite everyone to recognize our essential workers tonight. Representative Bob Mursky has encouraged everyone to light up Erie and to show their appreciation for all those essential workers out there. So this is a very easy thing to do, but we can collectively make Erie County just shine a little brighter tonight by flipping on your porch light or your front door light at 8 p.m. tonight. So hopefully we will see our community lit up. Just again, a little way of thanks to all those essential workers out there. And now I'd like to turn over to the media for questions. And today we will start with Erie News Now.
Good afternoon. A question for you regarding layoffs here in the county. Can you tell me roughly how many workers will be affected, and can you give me some examples of positions that will be eliminated for the time being?
So there's approximately 100 employees who will be furloughed, and the vast majority of those people are within our library system. As you know, our libraries have been closed for a number of weeks now, and so that will be the vast majority of individuals. But there are some from various other departments.
And will those workers keep their benefits during their furlough, or do they lose all of that as well?
They will be able to keep their health benefits, and when they return, they will then they will not have to pay their premiums while they are out. But when they come back, they can either decide to pay that premium that they did not pay either in a lump sum, or we will work out a plan to take a little bit more out of their paycheck over a period of time. But they will not lose their benefits while they were furloughed. Talk Erie?
Yes, good afternoon. Hi. Just regarding the mask issue, I saw a report earlier today where in L.A., law enforcement was handing out masks at the entrance to big box stores to those that don't have masks. Do you see the county kind of asking for some help? Because obviously government entities have better access to a lot of this personal protective equipment than the average citizen certainly does.
Right. So very good question about the masks. We are looking to try to find ways to obtain more of what we call the homemade masks, the cloth masks, that we could then get out to different populations who may struggle more to obtain one of those. We are not asking for people to wear anything fancy. You know, I've talked about even a scarf wrapped around your nose or your mouth, a bandana. I showed you yesterday my very simple mask that I made with a t-shirt and the instructions on how to make 3 different kinds of masks, I think maybe more instructions, on our website, eriecountypa.gov, and also I know on the CDC's website, as well as the state's Department of Health website. And so people can easily make their masks. I've seen 2 of those instructions which require no sewing at all. The one I made yesterday was simply a pair of scissors and a t-shirt. So it's not hard, but we know it still may be difficult for some, so we are looking at trying to obtain some other masks and having ways to distribute those to various populations throughout Erie County. People should not be wearing the N95s. We still need to save those for our healthcare workers. And the surgical masks, for the most part, should also be saved for our healthcare workers. There are some people who are vulnerable because of their own health conditions, where a surgical mask is certainly appropriate, so no one should shame anyone who's wearing a surgical mask out there because you don't really know why they're wearing that. But for some people, it's absolutely necessary that they wear a surgical mask. And actually, for those who are really, really vulnerable, hopefully they don't have to go out, but they may even have an N95. But for the most part, people can just wear your homemade cloth mask, either that you made or someone else made for you.
Just for clarification, ma'am, if somebody is attempting to walk into a store without a mask, they're to be told to turn around until they get one, right?
So it is going to be up to the business to have masks for all their employees and to ensure that those coming in also have a mask. Now, again, we're not trying to be punitive here, and people still need to get groceries and still need to get medications, and no one should be denied that. The regulations from the state basically state that if someone doesn't have a mask, then the grocery store or the pharmacy, those truly life essential things that people need, the store needs to make sure there's some way to bring that out to the individual, to their car. So, you know, I'm hoping that some businesses can find some masks that they could even leave at their front door for those people who come in and maybe don't have a mask, and then now they would have one. And as Judge Trisilla indicated, we are going to have masks at our doors at the courthouse for those few visitors. As we know, it's down to about 20 a day, but if we have any coming in for a court hearing or any other truly essential purpose, and they don't have a mask, we don't want to deny them access to their legal rights or even to the work they're trying to do. So we will have some masks available at our front door for those few people that are entering our business. And so that's what we're looking for other businesses to do. We also know that this directive came down on Wednesday. It goes it went into effect on Wednesday, but you know, we're asking for full compliance by Monday. But we also know some of these things are going to be very difficult. Like, we're also asking all businesses to do a temperature check on their employees coming in the door. Well, if you look for thermometers right now, you might be able to find them on the internet, but the delivery is often very slow. So we know that some businesses won't have the ability to do a temperature check on their employees come Monday. So what we're asking is, until you can find a thermometer and be able to do that yourselves, that you ask your employees to do their own temperature check at home if they have a thermometer, and to do that, and just to tell you, what's their temperature. It sounds all very onerous, and I know a lot of businesses are wondering how they're going to do that, and that's why we're saying we're here to help you at the Health Department at that 451-6700 number, or at our email at ecdhinfo@eriecountypa.gov. We want to answer your questions. We want to help you figure out how you can get through these new guidelines and be able to still conduct your business. And so that's what we're there to help you with. We're trying to all navigate this new world together. But again, I go back to the fact that if we can really show that Erie County can do this and do it really well, and we can see our numbers that right now are rising quite significantly, see that drop and truly level off, we think that we could be one of the earlier counties that get to reopen fully in terms of our businesses. Jet TV?
Thank you.
Hi, Kathy. It's Samir. So with these 7 new cases, do we think it's just happened, like these test results, they all came back, or do we think these are like fairly new?
They're fairly new. And I mean, one of them I know, the test just came back within less than 24 hours. So, I talked about the holiday weekend. Did more people get together than had been prior to that? I don't know if that's the case or not. Will we continue to see these numbers for, a few more days rising like this? I don't know. I don't have that crystal ball that we'd all love to have, but we do know that, I mentioned a number of these cases, 3 of them I believe. We know that they were from being near someone else who was a known positive or who became a known positive, probably maybe even after they were around them. And that's the thing. People often don't have symptoms right away, and yet they're still contagious. And then we have 3 cases that we don't know right now, and it's probably some sort of community spread. So again, social distancing, wearing a mask, wiping surface off, washing your hands 20 seconds once you come back home, or putting your hand sanitizer as soon as you get out of a store. All of those kind of things have to be part of your daily and hourly and minute-by-minute routine. And it's a new world, and it's a different thing for all of us to adjust to. And behaviors are hard to change. It's hard not to touch your face. We all feel, as soon as you say don't touch your face, everybody wants to touch their face. And so we have to just keep kind of talking about all these things that are important. And so we really believe these cases, again, are probably just because too many people have gotten together. They've gotten within 6 feet of each other, they didn't have masks on, and they had some contact with somebody who probably at the time maybe didn't even know that they were contagious, but they were. And that's the tricky thing about this virus. That's the dangerous thing about this virus.
Then is that worrisome, I guess, for you, since we are talking about trying to get the economy open back up, and Erie County possibly being part of that first wave? I imagine that has to be a little worrisome for you.
It's extremely worrisome for me. I was worried yesterday when I announced 4, and then today 7. These are big numbers for us as a county. They aren't big maybe compared to some other counties who have huge numbers, but we had been going along pretty well with just a few cases, 2, some days none, some days 1. And so this is the largest number I've announced yet in one day. And so if this trend continues, then you have to think about each one of those people and who were they around. And are we going to see some, the more numbers you have, of course, the more contacts you have to make and put people in quarantine, but some of those people in quarantine could then be positive, and maybe they were also contagious before they go into quarantine. And this is also just another thing why it's important for people to stay quarantined for those 14 days once they've been told to by the health department, because people become contagious and they don't even know that they are. And we know we have a lot of people out there, 25% of those who are positive, who have absolutely no symptoms. Erie Times News?
Yes, Kathy, it's David. Just to go back to what you had just said about it, is there anything from the investigations that confirms it was an Easter weekend get-together on any of these cases?
Not that I'm aware of. I'm not aware that it was that, but, I mentioned early in the week, we'll see what the post-Easter weekend brings. But today is Friday, so these cases came in late yesterday and early in the morning today. So it would be a fairly fast turnaround from Easter right now, but it could be, but I don't really have that basis of information.
And then one follow-up on that. Roughly in the past 5 days, there's been almost exactly 100 negative tests and 13 positives in Erie County, a 13% positivity rate, which is, I believe, much higher than what we've had. Is that a concern? Is that I want to get your thoughts on that. And it's not just here. I know that the rate of positive tests has jumped across the state in recent days. Is there anything about that? What do you take from that?
Well, obviously, it just concerns me because, again, I think people haven't really been adhering to some of the guidance we have given, and hence some of these numbers. But I don't really have enough background myself to speak any further than that on what this might mean in terms of the testing and all those other factors. But when the numbers go up like this, it concerns me greatly. And I want to get back to some place of normal. I want to get this economy back opened up in Erie County. I want to get people back to work and back to living, a life where they can see their families and such. So let's all work together to make that happen. That's the only way. I've said this from way in the beginning. The health department, the other leaders in this community, we can't do it by ourselves. We can only do it if the 278,000 approximately citizens of this community join with us in doing this. And I know that there's a lot of people out there who have been making fun of this and think it's all, not really a big deal, and, they don't want to wear a mask, and they're going to go and be with their friends, and, they're going to defy all of these guidelines. And the longer people continue to do this and the more the numbers continue to climb, the longer it's going to be before we can get this economy back open. And I think that's what we all really want more than anything right now. Erie News Now?
Going back to furloughs for a moment, would you tell me, again, with the furloughs and the other moves you're looking to make to tighten the budget a little bit, a ballpark on roughly how much you think you'll save through these measures? And then also, would you take me through the decision-making process of coming to the conclusion that despite wanting to avoid them, furloughs would be inevitable?
So I don't really have that number, but I can try to get that for you maybe for next week. Since it's Friday afternoon, I don't think my finance team will be able to do that for tomorrow, but I'll try to get that, kind of what ballpark we think we might be able to save on this. So I can't answer that one. And I'm sorry, the second part of your question again?
Sure. Would you take me through the decision-making process? I know layoffs were something you really had
Sure. Okay.
hoped to delay as long as possible. So just how do you come to that conclusion that you just had to pull the trigger on them?
Sure. Thank you. So in the beginning, when we basically closed down county government, so many of our employees are still extremely essential to the work that's being done in the community. We have about 1,200 employees, so we're talking about furloughing about 100. So obviously a fairly small percentage of our business compared to the entire population. But we do know specifically some departments just aren't seeing the amount of work. The libraries are closed. If we didn't have social distancing issues and some of those other things, we could bring everyone in, and I'm sure there would be plenty to do in each library branch that they could do collectively, but people can't be in the building, and people can't be in there working together. So we sent them all home except for a small number of library employees who actually have come on to what we call our incident command team, and they've been helping with some of our messaging and a lot of the work on the website, and they've been helping with some of the research that's being done for this whole pandemic that we need to have done on a daily basis internally. So we've utilized some of the library staff for that. But at one point we actually looked at, could we be a daycare for essential hospital employees? We actually did look at that, and could we have done that safely, but in the end it was decided that that was not feasible and not going to happen in county government. So then we tried to think, what else could we get these people to do that are home and they're not working, but we're still paying them. So right now they're in a project where they're calling everyone in the county about the census, just to remind citizens that we asked them to do the census. We thought that was a great use of their time while we're still paying them, and they are home. So anyway, we've tried our best to find other things for them to do, and now we've sort of run out of those opportunities. And so per their union contract, we have to give them a 2-week notice that they will be furloughed, and so that will be 2 weeks from today. So that kind of goes into our entire thought process. It's not easy. You know, we have great employees, and I expect that every one of them, I will hope, will be back, that they will want to come back at the end of this, and they will go back to the jobs that they love and that they do so well. Talk Erie?
Thanks.
Mm-hmm.
Yes, hi. I have a question for the President and Judge. Judge Trusillo, this is Valley, and I wanted to ask you, since this, some families go under extreme stress in this isolation. Have we seen any kind of trackable increase in the number of
We remain open to handle any allegation of domestic abuse or violence, so we're committed to that.
Thank you, sir.
Thank you. Jet TV?
Yeah, I'll stick with Judge Trusillo really fast. So whenever we're done with this, and let's say it's whenever the courts reopen, how delayed or backed up is that going to, or is the system going to be?
What we've been, thank you, Samir. What we've been trying to do is look at the types of hearings we can now, once we've made the initial adjustment under our emergency judicial order, we have incrementally started to look at what ramping up would look like. The most impactful area is, of course, the jury trial. I think you can expect a new normal there. I think what that's going to look like is I can't foresee in any time soon that we would cram the number of jurors into a small shoebox-sized room where they sit elbow to elbow. So that would contemplate us looking at Courtroom H, our ceremonial courtroom. Judge Kelly has been extremely cooperative in allowing us to use her courtroom and facilitating safe distancing and practices. So that's one way, and I also think I'm going to take a very hard look at, as the President Judge, to look at the number of jurors we're calling in on a day-to-day basis. I think we can streamline that number as well, but that's probably the most impactful area. We are starting to look at, for example, the practice in wills and trusts and probate law, in getting those perhaps back online in facilitating for example, the probating of a will through video or teleconference, and then swearing in, for example, the executor, who has to be sworn in person in a courtroom at safe distancing. That's just one illustrative example. But I think we're starting to look at ramping up slowly, but I think you can expect maybe a new normal.
Erie Times News.
Yes, Kathy, you had mentioned early on in the news conference here about talking with state officials about having Erie County perhaps starting the opening process early. How many more days of numbers like we've seen yesterday and today would that delay that and change your mind about volunteering Erie County early? Is it a matter of a few more days or another week of numbers like this? How long of a time period would this really be more than just a post-Easter bounce, if you will?
You know, that's hard to say, but one of the things we do know is the state has the scientists on their staff that we don't have that could help us determine sort of where we are in that trajectory. You know, I have great people who do great work, but when it comes to some of this research side of things, I don't have that type of staff in the health department or in county government. But I've had conversations as recent as last evening, and at that point, still thought, you know, and I still think, even with 7 today and 4 yesterday, I still think that Erie County is beating the trend, and we have this high period, but I'm just asking everybody to double down on your efforts. Maybe people were getting a little complacent as our numbers weren't growing, and so we need to double down on our efforts. Let's show that we can do this, and then I hope the state really does look long and hard at Erie County in northwestern Pennsylvania as being one of those places, probably the best place in the Commonwealth that has the talent and the skill set to be able to do the work. But we cannot do it without the support of the State Department of Health and the scientists and the really talented people that work in that department. So it's going to have to be a partnership. We're not going to do this on our own. And it's a partnership with our business community, our chamber, our Manufacturers and Business Association, and just so many others. So we're going to be starting some talks around that just to be prepared, because one of the things we were not prepared for the closure of all these businesses when that happened. It was very quick, and boom, all of a sudden businesses had to close. So as a community, we've been talking about the fact that we need to be ready for our reopening, and we need to have a plan, and so we are already starting to collectively talk about, what does that look like when the state says yes and when we're able to do that. But those time periods, that time frame is really on the state to help us determine.
And a quick follow-up, you didn't mention recoveries. Are we still at 22 people recovered from COVID-19 in the county?
Yeah, I didn't mention. I don't think I got an update on that today. I don't remember. I might have gotten, I don't remember another number besides that, but I will definitely have something for you tomorrow if that's changed at all, okay?
All right, thank you.
Sure. Erie News Now, do you have any final questions?
Yes, please, if I may. Just one final one regarding eventually opening things back up and understanding that will still likely be a while. Do you have some sort of a framework in your mind how you see this going? Would it be something where it's kind of a blanket lift of restrictions, or would you slowly increase which specific businesses suddenly fall under that essential category and could reopen? Just any clue of how you might eventually roll that out?
Again, it's going to be up to the state, because they are the ones who close the businesses down, and so they're going to have to determine how that comes about and how they reopen that. And I have not heard any plan for which businesses, if it would be all at once or if it would be a few at a time. But we'll wait on guidance from the state and the Department of Community and Economic Development on that.
And are you hopeful that the state doesn't do this as a Pennsylvania suddenly back open? Are you hopeful that maybe we could reopen sooner than some of the other harder hit areas?
I am hopeful that that's what happens, and that's the kind of conversation that I've had with the state. And I think they're looking at this from my conversations with them too, looking at parts of the state where we have not had the devastation such as they've had, for example, in the southeast, and so many of those Philadelphia and what they call the collar counties of Philadelphia, just as an example of an area that's been really hard hit. Talk Erie, do you have any final questions?
Yes, ma'am. Just one for you. We're entering another weekend where the faithful will not be able to attend in-person worship services no matter what their religion. And I heard an evaluation today that stated we villainized the churches that kept the ice cream shops and donut shops open. They were allowed to practice social distancing, but somehow the minister was not awarded that opportunity. Do you care to comment on that evaluation?
You know what, there's a lot of things about some of the closures and that have me sometimes scratching my head a little bit, and we've tried to help every single business figure out how to do it in a safe way. And so I didn't make those decisions. That was done on the state level, and they had their own decision-making process, of which I'm not privy to. But what I talked to a pastor yesterday, just because there was some question, people thinking, oh, we can open up that weekend of May 2nd and 3rd, open up our churches again and our synagogues and our temples. But this pastor and I had a conversation about people's lives, and so I think the churches, that's of course something they care very much about, is people's lives, and especially the most vulnerable and many elderly people that are in many of our churches. And so what does that look like going forward? And this pastor told me that he was making a plan with his fellow congregants and other religious of moving from one service to two and having one specific service for senior citizens and people who are more physically vulnerable. And it's great that he's already figuring a plan out for when things do reopen. And so I just appreciate all of the churches who did close their doors, and which I believe is all of them, and that they did that because they want to save people's lives. And they're finding new and unique ways to reach out and to really support the people that they pastor to over this really difficult time. Jet TV?
Thanks.
Do you have any final questions?
Yeah, Kathy, just one last one for you. So let's take a look back at the stay-at-home order. How do we think it's gone overall in the county, and do you think people are starting to really get tired of this?
I think people are very tired of it. You know what? I'm tired of it. I think we're all tired of it. I want to go out. I want to do more things. You know, I'm going to have a Zoom party with some friends tonight, you know, so we're all going to get on a Zoom call together, and friends I haven't seen now in quite a few weeks. So I'm doing the best I can too, and everybody's trying to do the best they can, and it's hard. It's really hard. It's hard for all of us, and I think we're all really tired of it. But I also know that it's saving lives, and it's the only way we're going to get our community back up and going is if we all do stay home and do keep our social distance and do wear a mask and do wash our hands and all of those things that we keep talking about. And I know it sounds like I'm a broken record some days, and I sound that way to myself sometimes. But we know it works, and we know we don't have any other tools. We don't have a magic bullet. We don't have a magic pill. We don't have a magic shot. And until we get that, unfortunately, we're going to have to do this until we can find a way out of this. And it's not just the United States. I actually think we have had a lot more freedom than other countries when I've seen complete lockdowns of people in neighborhoods in cities such as Madrid and Rome and Hanoi and all sorts of places across this globe. So, you know, let's just do our best, Erie County. Let's just continue to support each other and find ways to connect. You know, turn on your lights tonight at 8 o'clock. Do whatever it takes to find some beauty in your day. I posted a picture yesterday. I was out walking, and I happened to walk by Erie Insurance and all these beautiful bulbs out there. And so I took a picture and posted it because it was something that delighted me yesterday. I try to find something in my day that is life-giving, something that lifts me up. And I can't say enough that it's just hard, and it's hard for each one of us. And I wish we could all take this away from every one of you. But generations before us have suffered much more than this, and in much more dire ways. And now it's our turn to show what kind of a strong generation we are. And I thank the people of Erie County for doing that. Erie Times News, do you have any final questions?
Yes, Kathy, just on an age breakdown, what we see in Erie County is a much higher percentage of people with COVID ages 50 to 64 than we do statewide. It's 4 times the number, 36% versus just about 9%. Has anyone from the health department talked about that with you, why we're seeing that particular age group get hit so hard by this in Erie County as opposed to the state?
We haven't talked about it, but you know, I mean, I'm just going to say anecdotally and just from what I know, you know, we trend older than many other places in Pennsylvania, many of the bigger cities particularly, and some of those more populated areas. You know, Pennsylvania trends older than many other states in the United States. And, you know, I don't have really a lot of other good reasons other than just what I've read about other things going on. You know, the 25% of the people who are positive and don't know they are, what we call the asymptomatic. Anecdotally, I've just heard of a lot of younger people who kind of fall in that category, but I don't think it's just kept to younger people. That's just anecdotally. So again, because we don't have the researchers in county health department who can do some of that real digging in and that research type thing. They're just really trying every day to do their contact tracing and the enforcement and helping all our businesses and some of these other things which would be really great to sit down and look at and see if we could figure something out around it. Unfortunately, we don't have the bandwidth or the time to be able to do that right now, but things are busy. Things are really, really busy at the health department. I mean, there's so many things I haven't talked about here, what we're doing, but, you know, it is a lot of work for everyone who works for Erie County right now, and particularly the people that are in this incident command structure. And, you know, we're dealing from homeless issues to mass casualty preparation to, you know, what if we need another hospital and we had that many hospitalizations, and of course masks. We've been talking about masks since day one, N95s and cloth masks, and how do we get those into people's hands, and now how do we find thermometers, and how does everybody get one of those, and how do we support these new guidelines coming down from the state, and it's mind-boggling, all the things that come in front of us on a daily basis. You know, it would be great to dig into some of these, and I really appreciate your question, David, and I think it is something that's very curious, but again, I just don't think we have the bandwidth we don't have the researchers in our department who can help us figure out why this might be. But I appreciate the question. With that, I'm going to close out for today and thank all of you for, again, really looking at these guidelines. The guidelines that are for businesses is a two-sheeter that came out from the state. It's on our website, eriecountypa.gov, if you don't have it, but it's, of course, on the Pennsylvania Department of Health's website. It's really good. It says COVID-19 guidance for essential businesses, talks about protecting your employees, talks about protecting the employees that serve the public, and it talks about an employee who might have been exposed to COVID-19, and there's lots of resources there. So as you're working out your plan in your business, and as you're a person who's looking at going to that business, I really recommend that you look at this document and hopefully get some good information off of it. And I hope that all of you turn your lights on tonight at 8 o'clock just to recognize those essential workers who are out there, and I thank Representative Mirsky for bringing that idea forward. And particularly I want to thank Judge Trisilla for being on today. As you can see, the courts themselves are really busy, but they are also a great partner, and I really want to thank him for his counsel that he has given me on a myriad of issues throughout this entire pandemic. So with that, please stay home, please stay safe, please stay calm.
You've been watching today's update on COVID-19 from Erie County Executive Kathy Dahlkemper. In case you joined us kind of midstream here, some of the headlines from today's update, we'll try to make this quick. 7 new cases of COVID-19 confirmed by Erie County. The county executive announcing that brings a total of 53 positives overall for Erie County. That 7, by the way, is the largest single-day jump in Erie County since they started keeping track. County Executive Dahlkemper also saying that Erie County will furlough non-essential workers beginning May 1st. The numbers, she said, about 100, the vast majority coming out of the library system because, simply put, the libraries are not open. There is nothing for those employees to do anymore. So about 100 workers will be furloughed from the county as of May 1st. Also, Kathy Dahlkemper saying that she's notified Governor Tom Wolf that she would like the governor to at least consider Erie County in the first round of reopenings when it comes to that. The governor saying earlier this afternoon that he would provide more details next week concerning the plan to reopen Pennsylvania. The county executive saying that she has notified the governor that Erie County would enjoy being part of the first round of reopenings. And Kathy Dahlkemper mentioning President Judge John Trisilla there at the end. The President Judge talking about the fact that he has once again extended the judicial emergency order. The court restrictions will stay in place through May 31st. All right, let's take a look at the numbers now if we can. Confirmed cases of coronavirus locally. Told you there are 53 confirmed cases in Erie County. 7 new cases since yesterday. Crawford County still at 16. Warren County still at 1, 27 in Chautauqua County, New York with 3 deaths, 45 in Ashtabula County with 3 deaths. The newest numbers from the State Department of Health break down like this. More than 29,000 cases of COVID-19 in Pennsylvania, 756 deaths, that number up 49 from yesterday. Nearly 118,000 people testing negative. Best advice, we've been telling you day after day, it remains the best advice. Stay calm, stay home, wash your hands off, and practice social distancing of at least 6 feet. And of course, now wear that mask. Jet 24 carries a live, digital, exclusive coronavirus newscast every day, 3 times, 11:30, 3, and 9. It's on our website, YourErie.com, and the Your Erie To Go app. We'll have a complete wrap-up tonight on Jet 24 beginning at 5 o'clock. We're also live every night at 7 o'clock on Facebook. I want to thank you for joining us. I'll see you again at 5 o'clock. Good afternoon.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to YourErie.com. We now return you to your regularly scheduled programming.